Hello, everyone. This is Dr. Sandy, and today we're going to talk about what causes low back pain. If you're watching for the first time, my name is Dr. Sandy. I've been practicing chiropractic now for over 20 years. Personally, done over 300,000 adjustments. Me and my team have been blessed. We've won multiple awards, including Top Chiropractor in Mississauga, Top Chiropractor in Peel Region, because we are a results-focused office. And if you've been watching for some time and you're back again, thank you so much. It's something I really appreciate. And let's talk about today's topic. So we're going to talk about the low back. Obviously, as a chiropractor, this is something I see regularly. It's been so many years now, and there's always room to grow, room to learn. That I always believe that. So low back pain, very common. It's interesting now. I would say a huge amount of the workforce. If we kind of go back in time, more from an industrial type of workforce, and now we have like a professional type of workforce where it's people who are sitting all day in front of their computer. We are seeing back issues at very, very high rates. So what's happening is that there's pressure in that lower system. And we're talking in this video more about like L1 through L5 and the tailbone. Other structures can be involved, but these areas are very powerful. And why we really need to realize that the lower spine is so powerful. This is how we move. This is how we stand. Obviously, our posture can be affected by this as well. We need to have this healthy. We need to have this strong. And then internally, if you look at what organs can be impacted by the lower spine, by the tailbone area. It also includes your colon, the bladder, reproductive organs. They all are connected to these systems. So the lower spine is incredibly powerful and needs to be taken care of. Now, as I make this video as well, like I have to also explain, like some people may have this like back pain like once a year. It's very mild, kind of passes. Obviously, I don't want anyone to be in pain, but if that happens, usually not a big deal. They can go on with their normal life. But this video is more dedicated to someone kind of looking at solutions about like what's happened, how it's happened, and the pattern we're kind of look at. And a lot of times we'll meet a patient who comes to our office, and usually what they'll say to us is something like, I've had this back pain. It's been quite intense, maybe for the past 3-4 months. Maybe it's been over a year now at this time, which is obviously in my books, anything over a year, yes, that would be considered chronic. But it's getting to the point it's interfering with their life, and it could have started like, again, maybe once a month, turn into like weekly, and it may get to a point where it's daily. Usually the patient will also report that I would stretch a little bit, I would put on a heat pad, it would kind of go away. It seems like it's getting more intense. It went from maybe 1 or 2 out of 10, it's getting sometimes up to an 8 or 9 out of 10. Went from a dulling, Dr. Sandy, now it's more sharp, shooting pain. Sometimes it can even spread to different parts of the body, including the legs. So it's something that can be very scary if someone has it, and it can literally stop someone in their tracks. It may affect them professionally where they're missing work. It can even obviously affect them on the home front. It's hard to participate with your family when there's chronic low back issues. So it's something that definitely needs to be taken care of, needs to be addressed. And as always, I will always be the proponent of, as much as you can, going natural, respecting that, yes, in emergency situations where you've tried everything, you may need the drugs, injection, and surgery. But always I will take the position that should be the last resort. I think going into the spine, obviously like with a surgery, that is something that should be done with a lot of thought before someone goes to that level. Injections, again, the medication. I think we always have to step back and say, when we're getting those symptoms, especially those early stages where I think chiropractic can be very powerful, what is the body doing? I really believe symptoms are a security system. It's a way of preventing further damage, and they should not be ignored. They should not be suppressed. They should be something that should be acknowledged. So I would say anyone watching this, when you first start getting back issues that are reoccurring in the same area, the intensity is increasing, please get a checkup. Please get it assessed and just find out what's happening. Because again, that success rate of getting someone when they're early, when they're having those symptoms, will be much better. Having said that, we've had very difficult cases, challenging cases, and we were able to pull through, and we're grateful. But it shouldn't get to that point. And sometimes you also have to realize if someone waits too long, the only option may be injection or surgery or certain meds for a long period of time, whatever that is. So it's all about being proactive. It's all about listening to your body, caring for the body, and not just going from crisis to crisis to crisis, really saying, what is my body saying? So let's get into the main intent of the video. What are things that can cause it? So you can have a job again where you are just sitting a lot, which over time does wear and tear on the lower spine, the actual vertebrae, the disc, the muscle tissue. It's a complex system. There's a lot of things happening at that level. You have the spinal bones involved, the disc involved, the surrounding structures, ligaments, tendons. It's very complex. So constantly sitting, we are designed as human beings to be moving, walking, active. So if someone is sitting 3, 4, 5, 6, 7 hours a day, and then you have people who work from home, and then you have people who are on their computer when they finish work. As soon as they finish work, go on their laptop, get on their phone, and they're sitting even longer. And my big concern is, what about the youth, the younger generation, who are sitting all day, come home, sit even more, less active, very hard on the spine, very damaging to the spine. So that is one group we have to be aware of. Another group I would think is high risk is anyone who drives for a profession. So a truck driver, a taxi driver, Uber, those kind of things. If you're commuting heavily, you're sitting again very, very hard on the spine. So that could be a cause as well. Of course, if you've been in an accident, maybe sports related injury, or there was a slip or fall, that can definitely affect it. And that's also a good time to get checked. Maybe you've had a severe fall. Everyone's concerned about a fracture, which they should. Of course, they should get that assessed. But a lot of times I've seen that someone may have an injury and they'll say, okay, I went to the doctor, there was no fracture, and thank God for that. But maybe the bone's not broken, but maybe the lower bones have shifted. Maybe the lower spine has shifted, the tailbone has been altered, something's moved out of place. So there's nothing broken per se, but it's not in alignment, it's not an optimal function. And another thing you have to remember as well is that a lot of times when someone expresses to us that they're in pain or suffering, it could have started many months or even years ago. It doesn't have to show up at that time. And then sometimes someone can come in and say, oh, I just went down to pick up my keys, or I just went to bend down to tie my shoes, something very innocent, and their back just seizes. Well, I'm going to say with a high level of confidence, it's probably not just that day that happened, not that incident. It was probably building silently over time, or they had mild symptoms that were ignored and they have to be addressed. And then when we talk about life impact, we're talking again your career can get affected. You start missing work, or you're doing your work but you're in pain, so you're not giving your best. And then it can affect you on a personal level. So it's hard to participate with the family. Maybe your spouse needs your help in the house and you can't because you're constantly in pain. Or your kids want to play with you and you can't because you're constantly in pain, or you're just, maybe you're just pushing yourself. I've met people as well, and some patients who are like, I'm in pain and I'm suffering, but I've learned to push myself, and I admire that. That's great. But wouldn't it be better not to be in pain, and how much more you could flourish and really enjoy yourself? So it's something that needs to be taken care of. And again, gentle specific chiropractic, which is focused on the alignment, taking pressure off the nerve system, because always remember, your nerve system is powerful. Your nerve system, we're talking about the brain communicating to the body. We want that optimized. We want a clear crystal signal between brain and body, and that is the objective of chiropractic, so that you can move properly, be aware of the environment. Imagine having a computer with a slow processor. To me, that's what I see when I meet someone and I see pressure on the system. It's like a computer that's running slow, and we want to optimize that. That's like with the phone when they say, oh, a new version came out, or the software needs to get updated, or whatever it looks like. I feel with chiropractic, if I had to use an analogy, it's about aligning the system, optimizing the software, optimizing function. So yes, obviously we want to help people get out of pain, but we're also saying, what are we doing to optimize function? As I said, these lower areas not only control the muscle groups, hips and legs, they're going to those pelvic organs, the colon, the bladder, all those organs. We want clear signals there so those organs can work in a proper way. Legs can work properly. Things are functioning the way they should. It's all about optimal function. And then on top of it, you want to make sure that as you get older, you have that optimal function. We want to age gracefully. We want to be healthy. We want to be independent. We don't want so many health issues that, at a very younger age when, our quality of life just gets diminished, and then we're dependent on people, and we're feeling sick, we feel weak. That's not the point of life. That's not the way to live. We should be strong and healthy, using natural methods like chiropractic to live at that high level, so we cannot live in pain or fear or frustration. It shouldn't be that way. There's a gentle way, there's a natural way, by honoring the body, by looking at the nerve system, optimizing it so you can have the best life possible, so you can be healthy, you can be strong, so you can succeed in your career, so you can have a great family life, you can participate, and even for yourself, go to the gym, work out, do yoga, whatever that looks like. That's what it's about. That's what chiropractic is about. You living your best life possible by having healthy nerve system, a healthy software, if I could use that analogy, so you can be healthy, strong, naturally the way it was intended. So I hope that answers some of your questions. I hope you enjoyed the video. If you enjoyed the video, please like, share, leave a comment. That would mean a lot to me. Let's say you're listening to this and you just have a question. Please reach out to us. I'm available at 905-896-3393. Text us, call us maybe with a simple question. And if you're ready to go to the next level, we'd love to offer you a spinal checkup. We do a very thorough exam. We do several measurements, everything from blood pressure, bilateral weight scale, range of motion. We look at several things. But what I really like that we do is we have a special software that measures the health and the tone of the nerve system, how it's doing. We actually have metrics that shows how the nerve system is operating. It's a very powerful software. So we'd love to do that proper assessment. We're here for you to see what we can do to help. Is there a problem from the nerve system? Is it coming from the spine and nerve system? It's an amazing process we go through, and then we can let you know if we can help you or not. So contact our office for any questions, or if you want to book that checkup at 905-896-3393. Call or text us. Visit us on the web if you want to learn about us at gopowerflow.com. The name of our office is Powerflow Chiropractic, and as always, God bless you.